Drop foot is a condition that is caused by several problems. A drop foot can occur from injury to a tendon or muscle that generally suspends the foot or holds it up. It can also occur from neurologic or nerve conditions where a nerve is injured. A nerve can be injured in the spine from a disc or other type of spine injury, so that then the muscle that is innervated by that nerve becomes less functional and allows the foot to drop. It can also occur from trauma to nerves in the leg, and it might even occur, and in many instances occurs because of surgery around the knee. Often a knee replacement, where the knee previously was quite deformed and then is corrected into a new position, can cause loss of function in the nerve that crosses the knee, called the common peroneal nerve. When that nerve is injured, then the muscles that elevate the foot or bring it up, and to give you an example of what we're talking about here, these are the muscles in the front of the leg, and the primary muscle is called the tibialis anterior muscle. And when that muscle loses its nerve function, then the foot tends to drop down, and during walking isn't allowed to come up as part of that walking process, and thus the toes catch the ground because the ankle doesn't ride up. Typically, a patient that has this problem has to lift the leg up more significantly with other muscles to reduce the potential of that foot to drag or hit the floor. Now, a drop foot can be temporary, and it can also be more permanent. If it occurs on a temporary basis, or if you notice this from home and haven't had it checked, it should be checked immediately. And I would recommend seeing a doctor very quickly because you notice this condition. In almost every circumstance, it's appropriate that this be seen early on so that treatment can be started before this becomes more of a permanent condition for you. Even in short-term and in long-term conditions where a drop foot occurs, there are very good treatments that can be used for this. With regard to a home remedy, probably the best way you can treat this at home is to get an appropriate brace or appropriate shoe wear to help to elevate the foot and to reduce the pressure or the injury that's happening as you try to come across the ground as you're walking. And there are several braces that have been used in the market for this. As far as over-the-counter braces, the FootMind Elevate brace is an example of a brace that is a very comfortable brace that grabs the foot and pulls it up and holds it during walking, and allows for the body to compensate for the loss of the ability to hold the foot up. There are other braces that can be prescribed by your physician or doctor, and in that circumstance, you'll need to see the doctor for this. When you choose to see a foot specialist for your drop foot, several things will be done. First of all, neurologic testing will need to be taken care of to determine the cause of your drop foot. Once the cause is determined, then treatment will be started for that condition. If it's your spine, then you'll need to potentially see a spine doctor, and often in circumstances where that occurs, you may need an injection or sometimes even surgery to open up the space around that nerve. And that's something that I would consider doing fairly early on if a drop foot has occurred because of that. In addition, other treatments that your doctor will prescribe will include a custom brace initially, which can be a brace that's made out of plastic materials that holds the ankle up and slips inside the shoe. Usually that brace is going to be up almost to the knee in order to be able to hold the foot up adequately. And that's a very appropriate brace and can be very effective in improving the way that you walk. In addition, there are other types of braces similar to the FootMind Elevate brace. They can help to suspend the foot, and your doctor can decide if you're a candidate for something like that. Physical therapy can also be very helpful in retraining muscles and in stretching the ankle. One of the biggest problems that occurs with drop foot is the loss of ability to suspend the foot causes the foot to be stuck in a downward position over time because you're not pulling it up. And once it becomes stuck in that position, it can be very difficult for even a brace to help it. So physical therapy can be very effective in maintaining the motion and giving you ways to be able to hold the foot while you're waiting for those muscles to become more strengthened, or at least to return to some level of function. In addition, there are surgical treatments that can be helpful for drop foot. If bracing has failed, or if you are seeking a way to be able to function without the use of a brace, then occasionally surgery to transfer tendons from the back of your ankle to the front of the ankle to use those muscles to suspend the foot can be effective. It usually doesn't create a strength that would be the same as what you had previously, but it can be much better than it has been. And sometimes when augmented by a brace similar to the Elevate brace, it can be very successful in giving you a very good level of function.